So today we're looking at how you control your pelvis. So that's where most of your mass is, most of your weight, and it kind of dictates where you go. So if my pelvis goes that way, then my body goes that way. And that's what happens when we walk. For a lot of people after groin injuries or hip injuries, they lose some of that pelvic mobility, particularly with sideways movement. So if we look at our person from behind, getting more and more slack with these images as we go. When you land on your right leg, last week we showed that a particular movement happens. But as you start to transition through and you get into what we call mid-stance, this pelvis has to level out a little bit. But it means that it's moving towards the right leg if we land on the right leg. So if we land on the right leg, the pelvis is going to go this way. And then as we transition all our weight, as we step onto our left side, then the pelvis will go this way, to the left. So today's exercise is just showing, it's more of a challenge of can you control your pelvis and your legs as you move left and right. So with this exercise, it's really important that you get accurate feedback because generally after an injury, or if you just haven't used an area to its full potential in a while, the feedback that you're getting may not be accurate. And by feedback, I mean muscle stretching or joint capsules getting tighter. You may not feel those accurately. And it's important that you can use your hands or your eyes to get some of that extra feedback until your muscles and your joints can start to give that feedback for you again. So maybe do this exercise in front of a mirror so that you can see yourself. But using your hands, put them on top of your hips like this. And throughout the whole movement, we want them to stay the same level. So if I shifted to the right, they should stay level like this. Left side shouldn't drop and the right side shouldn't go higher. Same thing if I go to the left, can they stay the same height or do they drop? The second thing that we're looking at is rotation. So imagine you're on a straight line. As you go to the right, we're looking to that you don't rotate backwards or forwards. You just stay on this line, okay? Other options you can use are like a stick. If you put it on your belt line, that stick stays level as well. The exercise though, essentially, is find a comfortable width for you, hands on the hips, and you're gonna try pressing to the right and to the left, and don't let the hips become uneven. And this might look quite straightforward, but for a lot of people that have had injuries in these areas, this can be quite challenging. And so you're just going to go left to right. Do that for maybe about 1 minute to 2 minutes, and you might start to feel some hip muscles or some groin muscles coming back to life a little bit. And that's what we're looking for, getting some of that feedback.